Hi, everybody. This is Nurse Anna from nursestudy.net, and today we're going to be doing coronary artery disease, CAD. This is going to be NCLEX questions with answers and rationales. We're about halfway done with our cardiac series. Enjoy. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. A 58-year-old male with a history of coronary artery disease, CAD, reports chest pain that radiates to the left arm. His electrocardiogram, ECG, shows ST segment elevation in leads 2, 3, and AVF. Which intervention should the nurse anticipate next? A. Administer nitroglycerin and monitor blood pressure. B. Prepare the client for percutaneous coronary intervention, PCI. C. Administer morphine sulfate for pain relief. D. Initiate continuous cardiac monitoring. Answer, B. Prepare the client for percutaneous coronary intervention, PCI. Rationale, ST segment elevation in leads 2, 3, and AVF suggests an inferior myocardial infarction, MI, and PCI is the preferred treatment to restore blood flow. Nitroglycerin and morphine may be administered, but preparing for PCI is the priority intervention. Question 2. A 65-year-old female with a history of CAD is admitted with complaints of chest pain. She reports taking nitroglycerin 3 times without relief. Her vital signs are BP 150/90, heart rate 92, and respirations of 18. What is the nurse's next action? A. Administer a 4th dose of nitroglycerin. B. Notify the healthcare provider immediately. C. Administer 325 mg aspirin. D. Obtain an order for a stress test. Answer, B. Notify the healthcare provider immediately. Rationale, failure to relieve chest pain after 3 doses of nitroglycerin may indicate ongoing myocardial ischemia, requiring urgent evaluation and intervention. The healthcare provider must be notified immediately for further orders. Question 3. A client with a known history of CAD presents with sudden dyspnea, diaphoresis, and chest pain. The nurse notes a blood pressure of 80/50, and the client appears pale and clammy. What is the nurse's priority action? A. Administer IV nitroglycerin. B. Elevate the client's legs to improve circulation. C. Administer a fluid bolus of normal saline. D. Place the client in high Fowler's position. Answer, C. Administer a fluid bolus of normal saline. Rationale, the client is showing signs of cardiogenic shock, a complication of myocardial infarction. A fluid bolus is needed to increase blood pressure and perfusion. Nitroglycerin would further lower blood pressure and is contraindicated in this case. Question 4. A client with CAD is prescribed daily aspirin therapy. Which lab result should the nurse monitor to ensure the effectiveness of the treatment? A. Prothrombin time, PT. B. Platelet count. C. Hemoglobin and hematocrit. D. Serum cholesterol levels. Answer, B. Platelet count. Rationale, aspirin works by inhibiting platelet aggregation. Monitoring platelet count ensures that the medication is effectively reducing the risk of thrombus formation without causing thrombocytopenia. Question 5. A nurse is caring for a client who has just undergone coronary artery bypass grafting, CABG. Which complication related to CAD should the nurse monitor for during the postoperative period? A. Stroke. B. Deep vein thrombosis, DVT. C. Arrhythmias. D. Pulmonary embolism. Answer, C. Arrhythmias. Rationale, Post-CABG clients are at high risk for arrhythmias, particularly atrial fibrillation. Continuous cardiac monitoring is essential to detect and manage this complication early. Question 6. A client with CAD is scheduled for an exercise stress test. Which client instruction is most appropriate prior to the procedure? A. Do not eat or drink for 12 hours before the test. B. You will need to take your prescribed beta blocker before the test. C. Wear comfortable clothing and shoes suitable for exercise. D. Stop taking your statin medication 24 hours before the test. Answer: C. Wear comfortable clothing and shoes suitable for exercise. Rationale: clients undergoing an exercise stress test should wear appropriate clothing and shoes for physical activity. Beta blockers may be held as they can affect heart rate response, but statins do not need to be discontinued. Question 7. A 72-year-old male with a history of CAD presents with fatigue, nausea, and mild chest discomfort. His ECG shows T-wave inversions in the anterior leads. What is the most likely diagnosis? A. Stable angina. B. Unstable angina. C. Myocardial infarction. D. Prinzmetal angina. Answer: B. Unstable angina. Rationale: T-wave inversion in the anterior leads suggests ischemia. Unstable angina is characterized by new or worsening symptoms and requires immediate medical attention. Question 8. A nurse is reviewing discharge instructions with a client who has CAD and is prescribed a statin. Which statement by the client indicates a need for further education? A. I will take my medication at night before going to bed. B. I will avoid drinking grapefruit juice while on this medication. C. I will have my liver function tested regularly while taking this drug. D. I can stop taking the medication once my cholesterol levels are normal. Answer: D. I can stop taking the medication once my cholesterol levels are normal. Rationale: statins must be taken long-term, even if cholesterol levels normalize. Discontinuing the medication may lead to a return of high cholesterol levels and increased CAD risk. Question 9. A nurse is assessing a client with CAD who is scheduled for a coronary angiography. Which of the following is a priority assessment before the procedure? A. Renal function. B. Blood glucose levels. C. Lung sounds. D. Peripheral pulses. Answer: A. Renal function. Rationale: coronary angiography involves the use of contrast dye, which can affect renal function. It is crucial to assess kidney function before the procedure to prevent contrast-induced nephropathy. Question 10. A client with CAD is prescribed nitroglycerin for angina. The client reports experiencing a headache after taking the medication. What should the nurse advise the client? A. Stop taking the medication immediately and notify your healthcare provider. B. Headaches are a common side effect and usually decrease over time. C. Increase the dose of nitroglycerin to alleviate the headache. D. Take an over-the-counter sedative to help with the headache. Answer: B. Headaches are a common side effect and usually decrease over time. Rationale: nitroglycerin commonly causes headaches due to vasodilation, but this effect often diminishes with continued use. There is no need to stop the medication unless the headache is severe. Question 11. A nurse is caring for a client with CAD who presents with new-onset chest pain at rest. The client's troponin levels are elevated, but there are no ST segment changes on the ECG. What is the most likely diagnosis? A. Stable angina. B. Non-ST segment elevation myocardial infarction and STEMI. C. ST segment elevation myocardial infarction, STEMI. D. Prinzmetal angina. Answer: B. Non-ST segment elevation myocardial infarction, and STEMI. Rationale: elevated troponin levels indicate myocardial injury. The absence of ST segment elevation suggests an NSTEMI, which requires immediate treatment to prevent further cardiac damage. Question 12. A client with CAD is admitted for chest pain. The nurse reviews the client's lipid profile and notes elevated LDL cholesterol levels. What dietary recommendation should the nurse provide? A. Increase your intake of red meat and dairy products. B. Incorporate more fish and olive oil into your diet. C. Avoid all fats and oils in your meals. D. Focus on a low-fiber diet to improve digestion. Answer: B. Incorporate more fish and olive oil into your diet. Rationale: a diet rich in omega-3 fatty acids such as fish and olive oil can help reduce LDL cholesterol levels and lower the risk of further atherosclerotic plaque development. Question 13. A nurse is educating a client with CAD on the importance of smoking cessation. Which of the following best explains why quitting smoking is essential for clients with CAD? A. Smoking increases the production of HDL cholesterol. B. Smoking causes vasodilation, leading to decreased cardiac workload. C. Smoking accelerates the development of atherosclerosis in coronary arteries. D. Smoking decreases the effectiveness of beta blockers. Answer: C. Smoking accelerates the development of atherosclerosis in coronary arteries. Rationale: smoking contributes to the development and progression of atherosclerosis, which worsens CAD by further narrowing the coronary arteries and increasing the risk of myocardial infarction. Question 14. A nurse is caring for a client who has CAD and is taking a beta blocker. What is the priority assessment for this client? A. Monitoring for hyperglycemia. B. Checking heart rate and blood pressure. C. Assessing for signs of jaundice. D. Monitoring for increased urine output. Answer: B. Checking heart rate and blood pressure. Rationale: beta blockers lower heart rate and blood pressure, reducing myocardial oxygen demand. The nurse should regularly assess these parameters to ensure they are within a safe range and to detect bradycardia or hypotension. Question 15. A client with CAD presents to the emergency department with chest pain unrelieved by nitroglycerin. What is the most appropriate initial diagnostic test for this client? A. Chest X-ray. B. 12-lead electrocardiogram (ECG). C. Complete blood count (CBC). D. Echocardiogram. Answer: B. 12-lead electrocardiogram (ECG). Rationale: a 12-lead ECG is the first-line diagnostic test for clients presenting with chest pain, as it helps identify myocardial ischemia or infarction by detecting changes in the heart's electrical activity. Question 16. A nurse is teaching a client with CAD about the use of sublingual nitroglycerin. Which statement by the client indicates an understanding of the medication? A. I should take a pill every 15 minutes until the pain stops. B. I need to lie down before taking the nitroglycerin to avoid dizziness. C. I can take up to 5 pills if I still have chest pain after the first dose. D. I will store the nitroglycerin in the refrigerator. Answer: B. I need to lie down before taking the nitroglycerin to avoid dizziness. Rationale: nitroglycerin can cause dizziness and hypotension due to vasodilation. Clients should lie down to prevent falls and take the medication as directed, 1 pill every 5 minutes, up to 3 doses. Question 17. A client with CAD and a history of heart failure is prescribed furosemide. Which electrolyte imbalance should the nurse monitor for? A. Hypercalcemia. B. Hyperkalemia. C. Hypokalemia. D. Hypermagnesemia. Answer, C. Hypokalemia. Rationale: furosemide, a loop diuretic, can cause the loss of potassium through the urine, leading to hypokalemia. Monitoring electrolyte levels is critical to prevent complications like arrhythmias. Question 18. A client with CAD is prescribed a calcium channel blocker. What is the expected effect of this medication? A. Increased heart rate and blood pressure. B. Decreased myocardial oxygen demand. C. Increased contractility of the heart. D. Prevention of thrombus formation. Answer, B. Decreased myocardial oxygen demand. Rationale: calcium channel blockers decrease myocardial oxygen demand by lowering heart rate and blood pressure, which is beneficial in treating clients with CAD to prevent angina and ischemia. Question 19. A nurse is assessing a client with CAD who is experiencing an acute myocardial infarction. Which symptom is most concerning and requires immediate intervention? A. Severe chest pain lasting more than 30 minutes. B. Diaphoresis and nausea. C. Shortness of breath and cyanosis. D. An elevated heart rate of 110 beats per minute. Answer, C. Shortness of breath and cyanosis. Rationale: cyanosis and shortness of breath are signs of poor oxygenation and may indicate heart failure or cardiogenic shock, which requires immediate intervention to maintain oxygenation and perfusion. Question 20. A nurse is teaching a client with CAD about lifestyle changes. Which recommendation would be most effective in reducing the progression of coronary artery disease? A. You should reduce your daily intake of fruits and vegetables. B. Engage in moderate intensity exercise for at least 30 minutes a day. C. It is important to avoid all forms of dietary fat. D. Limit fluid intake to avoid overworking your heart. Answer, B. Engage in moderate intensity exercise for at least 30 minutes a day. Rationale: regular physical activity improves cardiovascular health, reduces cholesterol levels, and can help slow the progression of CAD. A diet rich in fruits and vegetables is also beneficial. Question 21. A client with CAD is scheduled for a cardiac catheterization. The nurse is explaining the risks of the procedure. Which complication should the nurse prioritize when informing the client? A. Infection at the catheter insertion site. B. Allergic reaction to contrast dye. C. Post-procedural bleeding. D. Dehydration from fasting. Answer, B. Allergic reaction to contrast dye. Rationale: an allergic reaction to the contrast dye used during cardiac catheterization can lead to life-threatening complications, such as anaphylaxis. This risk must be thoroughly explained to the client. Question 22. A nurse is caring for a client with CAD who is experiencing chest pain. Which lab result would be most indicative of myocardial injury? A. Elevated creatinine levels. B. Elevated troponin I levels. C. Decreased white blood cell count. D. Decreased hemoglobin levels. Answer, B. Elevated troponin I levels. Rationale: troponin I is a specific biomarker for myocardial injury. Elevated levels indicate damage to the heart muscle, such as in a myocardial infarction. Question 23. A client with CAD is prescribed clopidogrel. What should the nurse assess prior to administering the medication? A. Platelet count. B. Serum sodium levels. C. Liver function tests. D. Potassium levels. Answer, A. Platelet count. Rationale: clopidogrel is an antiplatelet medication that inhibits platelet aggregation. Monitoring platelet count is important to ensure the client is not at risk for bleeding complications. Question 24. A client with CAD is admitted with an acute myocardial infarction. Which medication should the nurse anticipate administering to prevent platelet aggregation? A. Metoprolol. B. Clopidogrel. C. Furosemide. D. Atorvastatin. Answer B. Clopidogrel. Rationale: clopidogrel is an antiplatelet agent used to prevent further thrombus formation in clients with acute coronary syndromes, such as myocardial infarction. Question 25. A nurse is caring for a client post-percutaneous coronary intervention, PCI. The client reports pain and swelling at the catheter insertion site. What is the nurse's priority action? A. Apply a warm compress to the site. B. Administer prescribed analgesics. C. Notify the healthcare provider immediately. D. Reassure the client that this is normal. Answer C. Notify the healthcare provider immediately. Rationale: pain and swelling at the catheter insertion site may indicate hematoma or arterial damage. Immediate intervention is required to assess and manage potential complications.
Hi, everyone. This is Nurse Anna from NurseStudy.net, and I think we're about halfway through our cardiovascular series. Today, we're going to be doing congestive heart failure, 25 questions with answers and rationales. Enjoy. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. A client with left-sided heart failure reports shortness of breath and orthopnea. On assessment, you auscultate crackles in the lung bases. Which medication should you anticipate the healthcare provider ordering first? A. Digoxin. B. Furosemide. C. Spironolactone. D. Metoprolol. Answer and rationale. B. Furosemide. Furosemide is a loop diuretic that will help reduce pulmonary congestion by eliminating excess fluid from the body, a primary issue in left-sided heart failure. Digoxin and metoprolol are used to control heart rate, but they do not address the immediate concern of fluid overload. Spironolactone is a potassium-sparing diuretic, but furosemide is more effective for rapid fluid reduction. Question 2. A 60-year-old male with a history of chronic heart failure presents to the emergency department with complaints of significant lower extremity edema, weight gain, and fatigue. Which clinical finding would indicate right-sided heart failure? A. Pulmonary crackles. B. Jugular vein distension. C. Tachypnea. D. Elevated troponin levels. Answer and rationale. B. Jugular vein distension. Right-sided heart failure is characterized by systemic venous congestion, leading to jugular vein distension, peripheral edema, and ascites. Pulmonary crackles and tachypnea are more indicative of left-sided heart failure. Elevated troponin levels are associated with myocardial injury, not specifically heart failure. Question 3. A client with heart failure is receiving an infusion of dobutamine for acute decompensation. What is the primary nursing assessment when administering this medication? A. Monitoring serum potassium levels. B. Assessing heart rate and blood pressure. C. Evaluating urine output. D. Measuring daily weight. Answer and rationale. B. Assessing heart rate and blood pressure. Dobutamine is a positive inotropic agent that increases cardiac output but can cause tachycardia and hypertension, requiring close monitoring of heart rate and blood pressure. While serum potassium and urine output are important, they are not the primary focus when administering dobutamine. Question 4. A client with heart failure is being educated on a low-sodium diet. Which food choice indicates the client understands the teaching of choosing appropriate food? A. Canned soup. B. Pickles. C. Fresh fruit. D. Deli meat. Answer and rationale. C. Fresh fruit. Fresh fruit is naturally low in sodium, making it an appropriate choice for a client on a low-sodium diet. Canned soup, pickles, and deli meat are typically high in sodium and should be avoided by heart failure clients. Question 5. A client with a history of heart failure is being treated with lisinopril. Which laboratory value should the nurse monitor closely due to the risk associated with this medication? A. Serum sodium. B. Serum potassium. C. Blood glucose. D. Hemoglobin. Answer and rationale. B. Serum potassium. Lisinopril is an ACE inhibitor that can cause hyperkalemia by decreasing aldosterone secretion, leading to potassium retention. Monitoring serum potassium levels is critical to prevent cardiac complications. Sodium, blood glucose, and hemoglobin are not directly affected by ACE inhibitors. Question 6. A client with heart failure reports increased fatigue and difficulty breathing at rest. What assessment finding would most strongly indicate worsening heart failure? A. S3 heart sound. B. Elevated blood pressure. C. Capillary refill of 3 seconds. D. Resting heart rate of 80 beats per minute. Answer and rationale. A. S3 heart sound. An S3 heart sound is often a sign of worsening heart failure due to the rapid filling of a dilated left ventricle. Elevated blood pressure and capillary refill may suggest other issues, but they are not specific to worsening heart failure. A resting heart rate of 80 beats per minute is within the normal range. Question 7. A client with chronic heart failure is prescribed carvedilol. What is the most critical nursing action prior to administering this medication? A. Assess respiratory rate. B. Monitor blood glucose. C. Check apical pulse. D. Evaluate lung sounds. Answer and rationale. C. Check apical pulse. Carvedilol is a beta blocker that can cause bradycardia, so it is important to check the apical pulse before administration. If the pulse is below 60 beats per minute, the nurse should withhold the medication and notify the healthcare provider. Respiratory rate, blood glucose, and lung sounds are less directly affected by this medication. Question 8. A client with heart failure is receiving spironolactone. Which potential complication should the nurse be most concerned about? A. Hypernatremia. B. Hypokalemia. C. Hyperkalemia. D. Hypocalcemia. Answer and rationale. C. Hyperkalemia. Spironolactone is a potassium-sparing diuretic, and the major risk is hyperkalemia, which can lead to dangerous cardiac arrhythmias. The other electrolyte disturbances are less likely with this medication. Question 9. A client with decompensated heart failure is started on intravenous nitroglycerin. Which clinical parameter should the nurse monitor most closely? A. Urine output. B. Blood pressure. C. Blood glucose. D. Serum creatinine. Answer and rationale. B. Blood pressure. Nitroglycerin causes vasodilation and can lead to significant hypotension. Monitoring blood pressure is essential to ensure it remains within safe limits. Urine output, blood glucose, and serum creatinine are important but not as immediately affected by nitroglycerin administration. Question 10. A client with left-sided heart failure is admitted with worsening dyspnea and frothy pink sputum. What is the priority nursing intervention? A. Administer IV morphine. B. Place the client in high Fowler's position. C. Start an infusion of dopamine. D. Administer fluid bolus. Answer and rationale. B. Place the client in high Fowler's position. High Fowler's position helps to improve oxygenation by promoting lung expansion in a client with pulmonary edema, which is causing the frothy pink sputum. Administering morphine or dopamine may be appropriate later, but improving oxygenation is the immediate priority. Fluid bolus would worsen the condition. Question 11. A client with chronic heart failure is receiving digoxin. The nurse notices that the client has developed nausea, vomiting, and a heart rate of 52 beats per minute. What should be the nurse's priority action? A. Administer antiemetics. B. Increase fluid intake. C. Hold the next dose of digoxin and notify the healthcare provider. D. Encourage the client to rest. Answer and rationale. C. Hold the next dose of digoxin and notify the healthcare provider. Nausea, vomiting, and bradycardia are signs of digoxin toxicity. The priority action is to hold the medication and notify the provider. Administering antiemetics or increasing fluids would not address the underlying toxicity, and rest does not resolve the issue. Question 12. A client is being discharged after a hospitalization for acute heart failure. Which instruction is most important to include in the discharge teaching to prevent future exacerbations? A. Increase daily intake of protein. B. Weigh yourself daily and report any weight gain over 2 pounds in 24 hours. C. Perform heavy lifting to improve cardiac output. D. Restrict potassium intake to prevent hyperkalemia. Answer and rationale. B. Weigh yourself daily and report any weight gain over 2 pounds in 24 hours. Daily weights help monitor fluid retention, a common issue in heart failure. Sudden weight gain indicates worsening heart failure and should be reported. Protein intake and potassium restriction are less relevant for most heart failure clients unless on specific medications. Question 13. A client with heart failure is prescribed both furosemide and lisinopril. Which electrolyte imbalance should the nurse monitor for most closely in this client? A. Hypercalcemia. B. Hypokalemia. C. Hypernatremia. D. Hyperkalemia. Answer and rationale. B. Hypokalemia. Furosemide, a loop diuretic, causes significant potassium loss, leading to hypokalemia. Lisinopril can cause hyperkalemia, but the risk is more immediate with the potassium wasting effects of furosemide. Question 14. A client with heart failure is receiving IV milrinone for acute decompensation. The nurse notes that the client has developed a new arrhythmia. What is the most likely cause of this new arrhythmia? A. Excessive potassium loss. B. Increased cardiac output. C. Reduced afterload. D. Direct effects of milrinone on cardiac muscle. Answer and rationale. D. Direct effects of milrinone on cardiac muscle. Milrinone increases contractility and can lead to arrhythmias as a side effect. The other options are less relevant, as milrinone's primary mechanism is through its effects on the heart muscle and vasodilation. Question 15. A client with right-sided heart failure is being evaluated for worsening symptoms. Which laboratory result would most strongly suggest worsening heart failure? A. Decreased hemoglobin. B. Increased B-type natriuretic peptide, BNP. C. Elevated white blood cell count. D. Low albumin. Answer and rationale. B. Increased B-type natriuretic peptide, BNP. BNP is released in response to ventricular stretching and volume overload, common in heart failure. An elevated BNP level suggests worsening heart failure. Hemoglobin, white blood cell count, and albumin levels are not directly related to heart failure. Question 16. A client with acute heart failure is prescribed dobutamine. What is the nurse's priority assessment while administering this medication? A. Capillary refill time. B. Blood glucose levels. C. Cardiac output and urine output. D. Serum calcium levels. Answer and rationale. C. Cardiac output and urine output. Dobutamine is a positive inotrope used to increase cardiac output, which should improve perfusion and urine output. Monitoring these indicators helps assess the effectiveness of the drug. Capillary refill, blood glucose, and serum calcium are less directly related to dobutamine's effects. Question 17. A client is admitted with worsening heart failure. The client's oxygen saturation is 88% on room air, and they are experiencing dyspnea at rest. What is the nurse's priority action? A. Administer oxygen via nasal cannula. B. Elevate the client's legs. C. Administer morphine. D. Provide a fluid bolus. Answer and rationale. A. Administer oxygen via nasal cannula. The client's oxygen saturation is below normal, and they are dyspneic, indicating the need for supplemental oxygen. Elevating the legs and administering fluids would worsen pulmonary congestion, while morphine is not the first-line intervention. Question 18. A client with left-sided heart failure is prescribed an angiotensin II receptor blocker, ARB. Which adverse effect should the nurse be most concerned about? A. Cough. B. Hyperkalemia. C. Hypoglycemia. D. Increased urination. Answer and rationale. B. Hyperkalemia. ARBs, like ACE inhibitors, can cause hyperkalemia by inhibiting the renin-angiotensin-aldosterone system. Cough is more associated with ACE inhibitors, and hypoglycemia or increased urination is not commonly associated with ARBs. Question 19. A client with decompensated heart failure is placed on fluid restriction. What is the best indicator that the fluid restriction is effective? A. Decrease in heart rate. B. Increase in urine output. C. Decrease in daily weight. D. Improved appetite. Answer and rationale. C. Decrease in daily weight. Daily weight is the most reliable indicator of fluid balance in heart failure clients. A decrease in weight suggests reduced fluid retention. Heart rate and urine output may improve but are not as reliable as weight monitoring. Question 20. A client with heart failure has an ejection fraction of 35%. Which symptom would most likely be present? A. Hypertension. B. Cyanosis. C. Fatigue and dyspnea. D. Hyperthermia. Answer and rationale. C. Fatigue and dyspnea. A reduced ejection fraction indicates poor cardiac output, leading to fatigue and dyspnea due to inadequate perfusion and oxygenation. Hypertension and hyperthermia are not direct consequences of low ejection fraction, and cyanosis occurs later if hypoxia becomes severe. Question 21. A client with chronic heart failure is prescribed metoprolol. Which assessment finding requires the nurse to hold the medication and contact the healthcare provider? A. Blood pressure of 110/70 mm of mercury. B. Heart rate of 48 beats per minute. C. Blood glucose of 140 mg per deciliter. D. Respiratory rate of 22 breaths per minute. Answer and rationale. B. Heart rate of 48 beats per minute. Metoprolol is a beta blocker that can cause bradycardia. If the heart rate is below 60 beats per minute, the medication should be withheld, and the healthcare provider notified. The other parameters do not contraindicate metoprolol use. Question 22. A client with heart failure is receiving education about medications. Which statement by the client indicates a need for further teaching? A. I will weigh myself every day at the same time. B. I should notify my doctor if I gain more than 2 pounds in 24 hours. C. I can stop my beta blocker if I feel better. D. I need to avoid adding salt to my food. Answer and rationale. C. I can stop my beta blocker if I feel better. Beta blockers should never be abruptly stopped, as this can cause rebound hypertension or worsening heart failure. The other statements indicate appropriate understanding. Question 23. A client with advanced heart failure is considering a heart transplant. What should the nurse include in the pre-transplant education? A. You will not need to take any medications after your transplant. B. You will need to take immunosuppressant medications for the rest of your life. C. Heart transplants guarantee a cure for heart failure. D. Your physical activity will be permanently limited after the transplant. Answer and rationale. B. You will need to take immunosuppressant medications for the rest of your life. After a heart transplant, clients must take immunosuppressant medications to prevent rejection. It is not a cure, and physical activity can often improve after recovery, not be permanently limited. Question 24. A client with heart failure is being treated with hydralazine and isosorbide dinitrate. Which side effect should the nurse monitor for closely? A. Hypertension. B. Dizziness. C. Bradycardia. D. Hyperglycemia. Answer and rationale. B. Dizziness. Hydralazine and isosorbide dinitrate are vasodilators, which can cause dizziness due to hypotension. Bradycardia, hyperglycemia, and hypertension are not typical side effects of these medications. Question 25. A client with end-stage heart failure is receiving palliative care. What is the nurse's priority intervention? A. Administering opioids to relieve pain and dyspnea. B. Encouraging the client to continue daily weight checks. C. Providing education on aggressive treatment options. D. Scheduling the client for cardiac rehabilitation. Answer and rationale. A. Administering opioids to relieve pain and dyspnea. In palliative care, the focus is on comfort, and opioids are commonly used to relieve pain and manage dyspnea in end-stage heart failure. The other options are less appropriate in the context of palliative care.
Hi, everyone. This is Nurse Anna from nursestudy.net. And in this test session, we're going to be looking at valvular heart disease, nursing answers with rationales. Enjoy. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. A 76-year-old male with a history of hypertension and coronary artery disease presents to the emergency department with complaints of exertional dyspnea and angina. His echocardiogram reveals aortic stenosis with a valve area of 0.7 centimeters squared. Which of the following is the most appropriate initial intervention for this patient? A. Administer sublingual nitroglycerin. B. Start the patient on intravenous furosemide. C. Arrange for an urgent valve replacement. D. Administer beta blockers to decrease heart rate. Answer, C. Rationale. A valve area of less than 1 square centimeter indicates severe aortic stenosis, and valve replacement is typically the definitive treatment. Nitroglycerin, A, may worsen symptoms due to decreased preload. Furosemide, B, is not indicated as the initial intervention for severe valvular disease. Beta blockers, D, can reduce cardiac output and worsen symptoms in aortic stenosis patients. Question 2. A 60-year-old female presents with complaints of palpitations, dizziness, and a history of a midsystolic click on auscultation. Which of the following diagnostic findings is most consistent with mitral valve prolapse, MVP? A. Left ventricular hypertrophy. B. Posterior leaflet thickening on echocardiography. C. Aortic regurgitation on Doppler studies. D. Right atrial dilation. Answer, B. Rationale: mitral valve prolapse is characterized by thickening or redundancy of the posterior mitral valve leaflet. Left ventricular hypertrophy, A, and aortic regurgitation, C, are not typically associated with MVP. Right atrial dilation, D, is not a primary finding in MVP. Question 3. A patient with mitral stenosis is admitted with worsening dyspnea and orthopnea. On physical examination, a loud S1 and a mid-diastolic murmur are heard. Which of the following is the most important intervention for symptomatic relief? A. Administer calcium channel blockers. B. Start intravenous vasopressors. C. Perform percutaneous mitral balloon valvuloplasty. D. Start the patient on an angiotensin-converting enzyme (ACE) inhibitor. Answer: C. Rationale: for severe mitral stenosis, percutaneous mitral balloon valvuloplasty is often the treatment of choice to relieve obstruction and symptoms. Calcium channel blockers, A, are not first-line therapy, and ACE inhibitors, D, are not indicated for valve stenosis. Vasopressors, B, are inappropriate in this context. Question 4. A patient with a history of aortic regurgitation due to a bicuspid aortic valve presents with increasing fatigue and shortness of breath. Which of the following physical examination findings would support the diagnosis of aortic regurgitation? A. Diastolic rumble at the apex. B. Loud S2 over the right sternal border. C. Waterhammer pulse. D. High-pitched midsystolic murmur. Answer, C. Rationale: a Waterhammer pulse or Corrigan pulse is a classic finding in aortic regurgitation due to the large stroke volume and rapid diastolic runoff. A diastolic rumble, A, is seen in mitral stenosis, and a loud S2, B, is not typical in aortic regurgitation. A high-pitched midsystolic murmur, D, is more consistent with aortic stenosis. Question 5. A 65-year-old female with mitral regurgitation is being evaluated for worsening dyspnea. The patient's echocardiogram shows a left ventricular ejection fraction, LVEF, of 40% and a regurgitant fraction of 55%. What is the most appropriate next step in management? A. Continue medical management with diuretics. B. Refer for mitral valve repair. C. Increase the dose of beta blockers. D. Perform cardiac resynchronization therapy. Answer: B. Rationale: severe mitral regurgitation with left ventricular dysfunction, LVEF less than 60%, warrants surgical intervention, typically valve repair. Continuing medical management, A, and increasing beta blockers, C, are insufficient for severe cases. Cardiac resynchronization therapy, D, is not the primary treatment for valvular dysfunction. Question 6. A 70-year-old male is being evaluated for heart failure symptoms. His echocardiogram shows severe aortic stenosis and moderate left ventricular hypertrophy. Which of the following symptoms is most indicative of a poor prognosis in aortic stenosis? A. Angina. B. Syncope. C. Fatigue. D. Orthopnea. Answer B. Rationale: syncope is a concerning symptom in aortic stenosis, often indicating a poor prognosis due to decreased cardiac output during exertion. Angina, A, and fatigue, C, are common but less critical indicators of prognosis. Orthopnea, D, is more associated with heart failure but does not directly predict outcomes in aortic stenosis. Question 7. A patient with newly diagnosed mitral regurgitation asks about the long-term consequences if left untreated. Which of the following complications is most commonly associated with untreated chronic mitral regurgitation? A. Aortic dissection. B. Pulmonary hypertension. C. Ventricular septal defect. D. Thromboembolism. Answer B. Rationale: chronic mitral regurgitation can lead to elevated left atrial pressure, which causes pulmonary hypertension. Aortic dissection, A, and ventricular septal defects, C, are unrelated to mitral regurgitation. Thromboembolism, D, is less common than pulmonary hypertension in chronic cases. Question 8. A 62-year-old female presents with dyspnea and palpitations. She has a history of rheumatic fever. Physical examination reveals a diastolic murmur and an opening snap. Which of the following valvular abnormalities is most likely present? A. Aortic stenosis. B. Mitral stenosis. C. Aortic regurgitation. D. Mitral valve prolapse. Answer B. Rationale: rheumatic fever can lead to mitral stenosis, often presenting with a diastolic murmur and an opening snap. Aortic stenosis, A, and regurgitation, C, do not typically produce an opening snap, and mitral valve prolapse, D, is associated with a systolic click, not a diastolic murmur. Question 9. A patient with a history of infective endocarditis is being evaluated for worsening shortness of breath. His physical examination reveals a decrescendo diastolic murmur at the left sternal border. Which of the following conditions is most likely causing his symptoms? A. Tricuspid regurgitation. B. Aortic regurgitation. C. Mitral valve prolapse. D. Pulmonary stenosis. Answer B. Rationale: a decrescendo diastolic murmur at the left sternal border is characteristic of aortic regurgitation, often seen in patients with a history of infective endocarditis. Tricuspid regurgitation, A, and pulmonary stenosis, D, are not typically associated with a diastolic murmur. Mitral valve prolapse, C, produces a midsystolic click. Question 10. A 55-year-old male with severe mitral stenosis is scheduled for mitral valve replacement surgery. During preoperative teaching, which of the following points should the nurse emphasize? A. The importance of long-term anticoagulation therapy post-surgery. B. The possibility of developing immediate postoperative hypertension. C. The need for regular echocardiograms to monitor left ventricular ejection fraction. D. The likelihood of needing repeat valve replacement within 5 years. Answer A. Rationale: after valve replacement, especially with mechanical valves, long-term anticoagulation is necessary to prevent thromboembolism. Postoperative hypertension, B, is less likely in mitral valve replacement, and echocardiogram monitoring, C, focuses more on regurgitation than stenosis. The need for repeat valve replacement, D, typically depends on the type of valve used, but it is usually much longer than 5 years for mechanical valves. Question 11. A patient with a history of mitral regurgitation presents with new onset atrial fibrillation. Which of the following is the most critical complication to prevent in this patient? A. Cardiogenic shock. B. Heart block. C. Thromboembolic stroke. D. Ventricular tachycardia. Answer C. Rationale: patients with mitral regurgitation who develop atrial fibrillation are at high risk for thromboembolic events, particularly stroke, due to stasis of blood in the left atrium. Cardiogenic shock, A, is less common and less severe heart failure develops. Heart block, B, and ventricular tachycardia, D, are not typical complications of atrial fibrillation in this setting. Question 12. A 58-year-old male with severe aortic stenosis is admitted with syncope and severe shortness of breath. His blood pressure is 90/60 mm of mercury, and his heart rate is 100 beats per minute. Which of the following interventions should the nurse anticipate for immediate management? A. Start an intravenous beta blocker. B. Administer IV fluids to increase preload. C. Schedule the patient for immediate cardioversion. D. Initiate continuous positive airway pressure, CPAP. Answer B. Rationale: in patients with aortic stenosis, maintaining preload is crucial, especially in the setting of low blood pressure. Administering IV fluids helps maintain hemodynamic stability. Beta blockers, A, would decrease heart rate and cardiac output, worsening the condition. Cardioversion, C, is not indicated without arrhythmia, and CPAP, D, would not address the underlying issue of low preload. Question 13. A 72-year-old patient with a history of mitral stenosis presents with dyspnea and hemoptysis. On physical examination, there is a diastolic murmur with an opening snap. Which of the following is the most likely explanation for the hemoptysis? A. Pulmonary embolism. B. Rupture of bronchial veins. C. Left atrial enlargement causing increased pulmonary pressure. D. Development of a ventricular septal defect. Answer C. Rationale: left atrial enlargement due to mitral stenosis increases pulmonary venous pressure, which can cause pulmonary hypertension and rupture of small pulmonary vessels, leading to hemoptysis. Pulmonary embolism, A, is less likely in this context, and bronchial vein rupture, B, is not a typical cause of hemoptysis in mitral stenosis. A ventricular septal defect, D, is unrelated to the pathophysiology of mitral stenosis. Question 14. A patient with severe aortic regurgitation is scheduled for aortic valve replacement. Which of the following preoperative findings would indicate the need for urgent surgery? A. Ejection fraction of 65%. B. A blood pressure of 130/80 mm of mercury. C. Symptoms of pulmonary edema. D. Mild left ventricular hypertrophy. Answer C. Rationale: pulmonary edema in a patient with severe aortic regurgitation indicates acute heart failure and necessitates urgent surgical intervention. An ejection fraction of 65%, A, is normal, and a blood pressure of 130/80 mm of mercury, B, and mild left ventricular hypertrophy, D, do not require immediate surgery. Question 15. A patient with mitral valve prolapse, MVP, is concerned about the risk of developing infective endocarditis. What should the nurse include in the patient teaching? A. Prophylactic antibiotics are required before all dental procedures. B. Mitral valve prolapse rarely leads to infective endocarditis. C. Antibiotics are only necessary if mitral regurgitation is also present. D. Regular blood cultures should be drawn to monitor for infection. Answer C. Rationale: antibiotic prophylaxis is recommended in patients with mitral valve prolapse and mitral regurgitation before dental procedures, as they are at higher risk for infective endocarditis. Patients without regurgitation do not need prophylaxis. Prophylactic antibiotics, A, are not always required, and regular blood cultures, D, are not indicated unless there is clinical suspicion of infection. Question 16. A patient with chronic aortic regurgitation is being managed conservatively. Which of the following clinical findings would indicate the need for surgical intervention? A. Stable ejection fraction of 60%. B. New onset of exertional dyspnea. C. Presence of a diastolic murmur. D. Mild aortic root dilation. Answer B. Rationale: exertional dyspnea is a sign of left ventricular dysfunction and worsening heart failure, which would warrant surgical intervention for aortic regurgitation. A stable ejection fraction, A, and mild aortic root dilation, D, do not indicate immediate surgery. A diastolic murmur, C, is an expected finding and does not necessarily require surgical intervention. Question 17. A 45-year-old patient with a history of rheumatic fever presents with fatigue and palpitations. Echocardiography shows moderate mitral stenosis. Which of the following is the primary pathophysiological mechanism responsible for the patient's symptoms? A. Left atrial enlargement causing atrial fibrillation. B. Increased left ventricular afterload. C. Decreased pulmonary venous pressure. D. Increased coronary artery perfusion. Answer A. Rationale: mitral stenosis causes increased pressure in the left atrium, leading to left atrial enlargement and a high risk of atrial fibrillation, which contributes to fatigue and palpitations. Increased afterload, B, is more relevant to aortic stenosis, and decreased pulmonary venous pressure, C, would not cause symptoms. Increased coronary artery perfusion, D, is unrelated. Question 18. A patient with severe aortic stenosis and heart failure presents to the emergency department with hypotension and syncope. Which of the following medications should be avoided in this patient? A. IV fluids. B. Furosemide. C. Nitroglycerin. D. Dobutamine. Answer C. Rationale: nitroglycerin should be avoided in patients with severe aortic stenosis as it reduces preload, which can further reduce cardiac output and lead to worsening hypotension. IV fluids, A, can help increase preload, while furosemide, B, is used with caution to manage heart failure symptoms. Dobutamine, D, can improve cardiac output and may be beneficial. Question 19. A patient with a bicuspid aortic valve is being monitored for aortic stenosis. Which of the following findings on echocardiography would suggest a progression to severe aortic stenosis? A. Aortic valve area of 1.5 square centimeters. B. Peak velocity across the valve of 2.5 meters per second. C. Left ventricular hypertrophy with an aortic valve area of 0.8 square centimeters. D. Ejection fraction of 70%. Answer C. Rationale: aortic valve area less than 1 square centimeter with left ventricular hypertrophy is indicative of severe aortic stenosis. An aortic valve area of 1.5 square centimeters, A, is moderate stenosis. A peak velocity of 2.5 meters per second, B, is also consistent with moderate stenosis. Ejection fraction, D, is not a direct measure of the severity of stenosis. Question 20. A patient with mitral regurgitation due to ischemic heart disease is undergoing echocardiographic evaluation. Which of the following findings would suggest the need for surgical intervention? A. Left ventricular ejection fraction of 50%. B. Left ventricular end-systolic diameter of 45 mm. C. Mild mitral regurgitation with normal left atrial size. D. Severe mitral regurgitation with left atrial enlargement. Answer D. Rationale: severe mitral regurgitation with left atrial enlargement suggests significant hemodynamic compromise, and surgery may be necessary. An ejection fraction of 50%, A, and a left ventricular end-systolic diameter of 45 mm, B, are within normal or mildly abnormal limits. Mild mitral regurgitation, C, typically does not require surgery. Question 21. A 68-year-old male presents with fatigue, exertional dyspnea, and orthopnea. He has a history of aortic stenosis and is scheduled for an echocardiogram. Which of the following findings would be the most concerning and warrant immediate intervention? A. Left atrial dilation with an ejection fraction of 60%. B. Aortic valve area of 1.2 square centimeters with a peak velocity of 2.8 meters per second. C. Severe aortic stenosis with an aortic valve area of 0.6 square centimeters and left ventricular ejection fraction of 35%. D. Moderate aortic regurgitation with preserved left ventricular function. Answer: C. Rationale: severe aortic stenosis with a valve area less than 1 square centimeter and a significantly reduced ejection fraction, less than 40%, is a critical condition that requires urgent intervention, usually aortic valve replacement. Left atrial dilation with a normal ejection fraction, A, and moderate aortic regurgitation, D, are not as immediately concerning. An aortic valve area of 1.2 square centimeters, B, indicates moderate stenosis. Question 22. A patient with chronic mitral regurgitation is experiencing increasing fatigue and decreased exercise tolerance. His echocardiogram shows a left ventricular end diastolic diameter, LVEDD, of 70 mm and an ejection fraction of 40%. Which of the following is the best treatment option? A. Continue monitoring with serial echocardiograms. B. Start the patient on beta blockers and ACE inhibitors. C. Refer for mitral valve repair or replacement. D. Perform percutaneous balloon valvuloplasty. Answer: C. Rationale: severe mitral regurgitation with evidence of left ventricular dilation, LVEDD greater than 55 mm, and reduced ejection fraction, less than 60%, requires surgical intervention to prevent further heart failure progression. Medical management with beta blockers and ACE inhibitors, B, is not sufficient in this case. Percutaneous balloon valvuloplasty, D, is more appropriate for mitral stenosis, not regurgitation. Question 23. A 55-year-old patient with a history of aortic regurgitation is admitted with worsening shortness of breath and signs of heart failure. The echocardiogram reveals a left ventricular ejection fraction of 35%. What is the most appropriate intervention at this time? A. Begin treatment with loop diuretics and ACE inhibitors. B. Increase the dose of beta blockers to control heart rate. C. Anticipate an order for aortic valve replacement surgery. D. Perform cardioversion to restore normal sinus rhythm. Answer: C. Rationale: severe aortic regurgitation with reduced ejection fraction, less than 50%, requires valve replacement to improve cardiac function and prevent further heart failure. Medical therapy with diuretics and ACE inhibitors, A, may provide symptomatic relief but is not definitive. Beta blockers, B, and cardioversion, D, do not address the underlying valvular issue. Question 24. A patient with severe mitral stenosis is experiencing increasing shortness of breath and fatigue. His echocardiogram reveals a mitral valve area of 0.9 square centimeters and a left atrial pressure of 25 mm of mercury. Which of the following does the nurse anticipate as the next step in the management of this patient? A. Initiate treatment with intravenous diuretics. B. Schedule the patient for percutaneous mitral balloon valvuloplasty. C. Start anticoagulation therapy to prevent thromboembolism. D. Begin treatment with digoxin to control heart rate. Answer: B. Rationale: Severe mitral stenosis with a valve area of less than 1 square centimeter and elevated left atrial pressure typically requires percutaneous mitral balloon valvuloplasty to relieve obstruction and symptoms. While anticoagulation, C, may be necessary if atrial fibrillation is present, the primary treatment is valvuloplasty. Diuretics, A, and digoxin, D, may provide symptomatic relief but are not definitive treatments for severe mitral stenosis. Question 25. A 60-year-old female with a history of rheumatic heart disease presents with worsening dyspnea, orthopnea, and hemoptysis. She is diagnosed with mitral stenosis. Which of the following clinical signs is most characteristic of this condition? A. A pansystolic murmur radiating to the axilla. B. A loud S1 with an opening snap. C. A harsh systolic ejection murmur heard over the right upper sternal border. D. A diastolic rumble, best heard at the lower left sternal border. Answer: B. Rationale: mitral stenosis is typically associated with a loud S1 and an opening snap, followed by a diastolic murmur. A pansystolic murmur radiating to the axilla, A, is characteristic of mitral regurgitation. A harsh systolic ejection murmur, C, is indicative of aortic stenosis, and a diastolic rumble at the lower left sternal border, D, is not typical of mitral stenosis.
Hi, everyone. This is Nurse Anna from nursestudy.net, and here we have 25 NCLEX questions with answers and rationale for cardiomyopathy. Enjoy. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. A 55-year-old patient with dilated cardiomyopathy is admitted for increasing dyspnea and fatigue. The nurse assesses the patient's medication list. Which of the following medications should the nurse anticipate the healthcare provider will order to improve cardiac output? A. Metoprolol. B. Furosemide. C. Digoxin. D. Lisinopril. Answer: C. Digoxin. Rationale: digoxin increases the force of myocardial contraction, improving cardiac output, which is crucial in dilated cardiomyopathy. Metoprolol, A, may be used to reduce heart rate but doesn't directly improve contractility. Furosemide, B, manages fluid overload but doesn't increase contractility. Lisinopril, D, reduces afterload but doesn't increase the force of contraction. Question 2. A patient with hypertrophic cardiomyopathy presents with sudden syncope. Which of the following interventions should the nurse prioritize? A. Administer oxygen. B. Initiate CPR. C. Prepare for defibrillation. D. Assess the airway and breathing. Answer: D. Assess the airway and breathing. Rationale: syncope in hypertrophic cardiomyopathy is often related to outflow obstruction or arrhythmias. While CPR, B, and defibrillation, C, may be required if the patient arrests, airway and breathing, D, should always be prioritized. Oxygen, A, can be initiated after airway assessment. Question 3. A patient with dilated cardiomyopathy is scheduled for an implantable cardioverter defibrillator, ICD, insertion. The patient asks why this is necessary. What is the most appropriate response by the nurse? A. The ICD will prevent further progression of cardiomyopathy. B. The ICD will regulate your blood pressure. C. The ICD will correct life-threatening arrhythmias. D. The ICD will improve your overall heart function. Answer: C. The ICD will correct life-threatening arrhythmias. Rationale: ICDs are used to correct life-threatening arrhythmias that are common in patients with dilated cardiomyopathy. The ICD does not prevent disease progression, A, regulate blood pressure, B, or directly improve heart function, D. Question 4. A patient with restrictive cardiomyopathy is experiencing severe dyspnea. Which of the following is the nurse's priority action? A. Administer a bronchodilator. B. Elevate the head of the bed. C. Administer IV fluids. D. Perform chest physiotherapy. Answer, B. Elevate the head of the bed. Rationale: elevating the head of the bed improves lung expansion and reduces the work of breathing in a patient with cardiomyopathy and dyspnea. Bronchodilators, A, are not indicated unless there is a coexisting respiratory condition. IV fluids, C, could worsen the condition by increasing preload. Chest physiotherapy, D, is not indicated for cardiomyopathy. Question 5. A patient with hypertrophic cardiomyopathy is prescribed a beta blocker. What is the primary goal of this medication in this condition? A. To increase cardiac contractility. B. To reduce the risk of thromboembolism. C. To reduce the heart rate and myocardial oxygen demand. D. To improve pulmonary function. Answer, C. To reduce the heart rate and myocardial oxygen demand. Rationale: beta blockers reduce heart rate and myocardial oxygen demand, which helps prevent outflow obstruction in hypertrophic cardiomyopathy. They do not increase contractility, A, or directly affect thromboembolism risk, B. Beta blockers do not improve pulmonary function, D. Question 6. A patient with dilated cardiomyopathy is admitted with pulmonary edema. Which of the following interventions should the nurse implement first? A. Administer IV furosemide. B. Insert an indwelling urinary catheter. C. Obtain a chest X-ray. D. Start an infusion of normal saline. Answer, A. Administer IV furosemide. Rationale: furosemide helps reduce fluid overload, a priority in treating pulmonary edema. Inserting a catheter, B, or obtaining a chest X-ray, C, can be done after stabilizing the patient. Administering normal saline, D, would worsen the patient's condition by increasing fluid volume. Question 7. A patient with cardiomyopathy is experiencing fatigue and shortness of breath. The nurse notes jugular vein distension and bilateral pitting edema. What nursing intervention is most appropriate? A. Encourage increased oral fluid intake. B. Educate the patient about daily weight monitoring. C. Encourage the patient to walk every 2 hours. D. Restrict sodium to 4 grams per day. Answer, B. Educate the patient about daily weight monitoring. Rationale: monitoring daily weight helps assess fluid retention, a key management strategy in cardiomyopathy. Increasing oral fluids, A, and sodium restriction, D, are not appropriate unless specified by the healthcare provider. Walking, C, may be limited due to symptoms. Question 8. A patient with hypertrophic cardiomyopathy reports dizziness when standing up. Which teaching point is most important for the nurse to include? A. Increase fluid intake. B. Avoid standing up quickly. C. Increase salt intake. D. Decrease physical activity. Answer, B. Avoid standing up quickly. Rationale: orthostatic hypotension can occur in hypertrophic cardiomyopathy, and standing up slowly can prevent dizziness. Increasing fluids, A, and salt, C, may help in some cases, but should be prescribed. Decreasing activity, D, may not address the underlying issue. Question 9. A patient with restrictive cardiomyopathy is at risk for thromboembolism. Which of the following interventions should the nurse anticipate? A. Administering aspirin. B. Administering warfarin. C. Administering clopidogrel. D. Administering heparin. Answer, B. Administering warfarin. Rationale: warfarin is often used for long-term anticoagulation in cardiomyopathy patients at risk for thromboembolism. Aspirin, A, and clopidogrel, C, are antiplatelet agents, not anticoagulants. Heparin, D, is used for acute, short-term management. Question 10. A patient with dilated cardiomyopathy is prescribed an angiotensin-converting enzyme (ACE) inhibitor. The patient asks why they need this medication. Which is the best response by the nurse? A. It reduces fluid buildup in your lungs. B. It will make your heart pump stronger. C. It decreases the workload of your heart by lowering blood pressure. D. It prevents the formation of blood clots. Answer: C. It decreases the workload of your heart by lowering blood pressure. Rationale: ACE inhibitors lower blood pressure and reduce afterload, which decreases the heart's workload. They do not increase contractility, B, or prevent blood clots, D. Reducing fluid buildup, A, is a secondary effect. Question 11. A patient with hypertrophic cardiomyopathy is admitted for worsening chest pain. Which of the following medications should the nurse question if ordered by the healthcare provider? A. Metoprolol. B. Nitroglycerin. C. Verapamil. D. Amiodarone. Answer: B. Nitroglycerin. Rationale: nitroglycerin should be used cautiously in hypertrophic cardiomyopathy because it reduces preload, potentially worsening the outflow obstruction. Metoprolol, A, and verapamil, C, are used to manage symptoms by reducing heart rate and contractility. Amiodarone, D, is used to treat arrhythmias. Question 12. A patient with dilated cardiomyopathy presents with symptoms of heart failure, including significant edema. The healthcare provider orders a low-sodium diet. Which rationale should the nurse provide for this intervention? A. It helps to strengthen your heart muscles. B. It reduces fluid retention, which helps decrease the workload on your heart. C. It will improve your breathing. D. It will help increase your energy levels. Answer: B. It reduces fluid retention, which helps decrease the workload on your heart. Rationale: sodium contributes to fluid retention, exacerbating heart failure. A low-sodium diet helps reduce fluid overload and the workload on the heart. It does not directly strengthen the heart, A, or increase energy levels, D, and while it may improve breathing, C, the primary benefit is reducing fluid retention. Question 13. A 42-year-old patient with restrictive cardiomyopathy reports worsening fatigue and shortness of breath. Upon assessment, the nurse notes decreased breath sounds at the lung bases and peripheral edema. Which nursing diagnosis is most appropriate? A. Impaired gas exchange. B. Activity intolerance. C. Ineffective airway clearance. D. Deficient knowledge. Answer: B. Activity intolerance. Rationale: fatigue and shortness of breath with peripheral edema in restrictive cardiomyopathy indicate decreased cardiac output, leading to activity intolerance. Impaired gas exchange, A, could be a secondary problem, but there is no evidence of hypoxemia. Ineffective airway clearance, C, and deficient knowledge, D, are less appropriate based on the data provided. Question 14. A patient with hypertrophic cardiomyopathy is undergoing genetic testing. The patient asks the nurse, "Why is my family being asked to get tested too?" What is the nurse's best response? A. This test can determine if you inherited your condition. B. We want to see if your condition is worsening. C. This test checks for heart function in your family members. D. It helps to evaluate your risk for other types of heart disease. Answer: A. This test can determine if you inherited your condition. Rationale: hypertrophic cardiomyopathy is often genetic. Testing family members can identify whether they have inherited the condition, which allows for early intervention. The test does not check current heart function, C, or predict the progression of the disease, B. Question 15. A patient with dilated cardiomyopathy is being discharged with a new prescription for spironolactone. Which teaching point should the nurse emphasize? A. Take this medication at bedtime to avoid dizziness. B. Avoid foods high in potassium while taking this medication. C. Monitor your blood pressure daily to avoid hypotension. D. Report any weight gain greater than 2 pounds in 24 hours. Answer, B. Avoid foods high in potassium while taking this medication. Rationale: spironolactone is a potassium-sparing diuretic, so patients should avoid foods high in potassium to prevent hyperkalemia. Monitoring weight gain, D, is important in heart failure, but potassium intake, B, is specific to spironolactone. Taking the medication at bedtime, A, is not necessary, and monitoring blood pressure, C, is important but secondary to potassium monitoring. Question 16. A patient with hypertrophic cardiomyopathy asks the nurse about exercise. Which is the most appropriate response? A. You should avoid all types of physical activity. B. Engage in moderate exercise like walking but avoid high-intensity activities. C. You can participate in any exercise if you feel well enough. D. Only high-intensity sports are recommended to build heart strength. Answer, B. Engage in moderate exercise like walking but avoid high-intensity activities. Rationale: patients with hypertrophic cardiomyopathy should avoid high-intensity activities that can exacerbate outflow obstruction or provoke arrhythmias, but moderate activities like walking are beneficial. Avoiding all physical activity, A, is not necessary, and high-intensity sports, D, are contraindicated. Question 17. A patient with restrictive cardiomyopathy is scheduled for a cardiac catheterization. Which of the following should the nurse include in pre-procedure teaching? A. You will need to fast for 12 hours before the procedure. B. A small incision will be made in your chest. C. This procedure will assess the pressure inside your heart. D. You will be under general anesthesia during the procedure. Answer, C. This procedure will assess the pressure inside your heart. Rationale: cardiac catheterization is used to measure intracardiac pressures in restrictive cardiomyopathy, a key diagnostic tool. Fasting is typically required for 6 to 8 hours, A, not 12 hours. The incision is in the groin or arm, not the chest, B. The patient will usually be sedated, not under general anesthesia, D. Question 18. A patient with hypertrophic cardiomyopathy is prescribed an antiarrhythmic medication. What should the nurse monitor closely during therapy? A. Blood glucose levels. B. Heart rhythm on a cardiac monitor. C. Urine output. D. Mental status. Answer, B. Heart rhythm on a cardiac monitor. Rationale: antiarrhythmic medications can potentially cause or worsen arrhythmias, so continuous cardiac monitoring, B, is essential. Blood glucose, A, urine output, C, and mental status, D, are not directly related to the effects of antiarrhythmic therapy. Question 19. A patient with dilated cardiomyopathy is experiencing orthopnea and paroxysmal nocturnal dyspnea. Which of the following should the nurse recommend? A. Sleep with the head of the bed elevated. B. Increase fluid intake before bedtime. C. Perform deep breathing exercises. D. Use compression stockings. Answer, A. Sleep with the head of the bed elevated. Rationale: elevating the head of the bed can help reduce venous return and improve breathing for patients with orthopnea and paroxysmal nocturnal dyspnea. Increasing fluid intake, B, would worsen symptoms, and deep breathing, C, and compression stockings, D, are not directly beneficial in this situation. Question 20. A patient with hypertrophic cardiomyopathy presents with chest pain and palpitations. Which diagnostic test should the nurse anticipate being ordered first? A. Chest X-ray. B. Echocardiogram. C. Stress test. D. Electrocardiogram ECG. Answer, D. Electrocardiogram ECG. Rationale: an ECG is typically the first diagnostic test ordered to assess for arrhythmias in patients with hypertrophic cardiomyopathy presenting with chest pain and palpitations. An echocardiogram, B, may be ordered after the ECG to assess structural abnormalities. Chest X-rays, A, and stress tests, C, are useful, but not the first-line test. Question 21. A patient with restrictive cardiomyopathy has an ejection fraction, EF, of 30%. Which nursing action is the priority? A. Encourage physical activity. B. Educate the patient on low-sodium diet. C. Monitor for signs of heart failure. D. Instruct on fluid restriction. Answer: C. Monitor for signs of heart failure. Rationale: with an ejection fraction of 30%, the patient is at high risk for heart failure, making monitoring for signs of decompensation the priority. Educating about diet, B, and fluid restriction, D, is important but secondary to immediate monitoring. Question 22. A patient with dilated cardiomyopathy is at risk for ventricular arrhythmias. What intervention should the nurse anticipate to reduce this risk? A. Administering amiodarone. B. Administering digoxin. C. Administering beta blockers. D. Administering nitrates. Answer: A. Administering amiodarone. Rationale: amiodarone is an antiarrhythmic that reduces the risk of life-threatening ventricular arrhythmias in patients with dilated cardiomyopathy. Beta blockers, C, help control heart rate but are less effective at preventing arrhythmias. Digoxin, B, improves contractility, and nitrates, D, are used for chest pain management. Question 23. A patient with hypertrophic cardiomyopathy reports palpitations and dizziness. Which lifestyle change should the nurse recommend to reduce symptoms? A. Increase salt intake. B. Engage in strenuous exercise. C. Avoid dehydration. D. Sleep in a supine position. Answer: C. Avoid dehydration. Rationale: dehydration can exacerbate the symptoms of hypertrophic cardiomyopathy by reducing preload, worsening the obstruction. Patients should avoid dehydration to maintain adequate blood volume. Increasing salt intake, A, and strenuous exercise, B, are not recommended, and sleep position, D, is less relevant. Question 24. A patient with restrictive cardiomyopathy asks the nurse about treatment options. Which treatment is most likely to be recommended? A. Heart transplant. B. Coronary artery bypass graft, CABG. C. Percutaneous coronary intervention, PCI. D. Ventricular assist device, VAD. Answer: A. Heart transplant. Rationale: restrictive cardiomyopathy often has limited treatment options, and heart transplant may be the only definitive treatment for end-stage disease. CABG, B, and PCI, C, are treatments for coronary artery disease, not cardiomyopathy, and VADs, D, are used in dilated cardiomyopathy. Question 25. A patient with dilated cardiomyopathy is prescribed a diuretic and a beta blocker. Which assessment is most important for the nurse to perform before administering these medications? A. Blood pressure and heart rate. B. Blood glucose levels. C. Oxygen saturation. D. Peripheral pulses. Answer: A. Blood pressure and heart rate. Rationale: both diuretics and beta blockers can lower blood pressure and heart rate, so these parameters must be assessed before administration. Blood glucose, B, oxygen saturation, C, and peripheral pulses, D, are important but less relevant in this scenario.